David, great to have you here today.
Great to be here.
I love getting together with you, and I think we always say we can talk for hours and hours when it starts talking about how the brain and body work together. And give us a little background of yourself. I know you're a local chiropractor here, been in the neighborhood or in the community for a long time.
Yes, we have a family practice, and we adjust newborn babies all the way up. I think our oldest patient's 96 years old.
Wow. Wow, that's awesome.
Yeah.
I love, from a neuroscience side, working with chiropractors. My dad's a chiropractor. I actually started taking my pre-med towards chiropractic and everything, and so it's kind of a definite passion of mine growing up with it.
Well, I love what you do because we work with the nervous system, and we're trying to free the pathways of the nervous system, but you actually repair those neural pathways in the brain, which is so important because that's the master conductor.
Yeah.
And that controls everything. It controls our healing. You know, we have inputs from the brain down to the body. The body needs that for healing and function. But a lot of people don't know there's 40 times more information going up to the brain for the brain to get that information to know what to do. So it goes hand in hand.
It is hand in hand, because then once the brain makes a decision, it has to fire off back to the body, which all goes through the spinal cord, all through your whole backbone and everything, which is, if that's damaged or not working or something, it's going to be problems with that too. So today we're talking about concussion. We've dealt with a lot of patients in common that have had concussions, and that's why I kind of wanted to talk with you about this, because we've had a lot of experience together. It's really interesting. There's so many multifacets to concussion injury. Not every concussion is not the same, right? And there's not like just a general concussion protocol. It's really assessing that person, seeing what actually happened, what are the mechanical side of it, what's the brain side, what's the compensation, where the body started compensating afterwards. Why don't you start by telling people a little bit, because I think there's a lot of a misunderstanding of what a concussion is out there.
Right. And, damage and inflammation of the brain can happen so many ways, and we always think about the macro traumas, like the car wrecks. But the micro traumas, like kids falling, without their parents even seeing it, could cause inflammation of the brain and cause pressure on that nervous system and the spinal cord as well. We had a patient that was just repeatedly went on a roller coaster many times in a row, and it caused inflammation. You wouldn't think of that. That was something new that I didn't even realize. That could happen. So there's just so many different things. And, from my perspective, if you damage those neurons in the brain and those pathways, it's what you do is essential to heal them. But a lot of times, as we were talking about earlier, when there's trauma, like say a whiplash car wreck or a sports injury or something like that, when you have a concussion, it becomes an emergency. We want to take that pressure out and get the swelling out of the brain. But it's the long-lasting effects that we deal with. And you know more about what you're dealing with the brain, but you can pick that up even years later. I've seen it with so many of my patients that didn't even know that they had damage to the brain. And other people, like myself, I was like, for sure, I was in 2 rollover car wrecks. I was a football player. I was a wrestler. I had that. And I didn't have as much damage that I thought I did. But it's like we test, we don't guess, right?
Right. That's exactly
And same thing with chiropractic. What happens is when there's an emergency, no one really looks at the ligaments that hold the spine in place. And the spine is there. It's your suit of armor. It's there to protect that delicate nerve fiber and that information going up to your brain or going down from your brain. And so that's what we check for. We check for restrictions so we can get that cerebral spinal fluid moving properly, get the nutrition and those impulses to the brain.
I love how you said, the spine and stuff is like your suit of armor, because so many people think a concussion happens just from this small thing that just happened. And a lot of times they're like, how could that small thing, how could slamming your tailbone cause a concussion? And a lot of this is pre-existing things that are building up, leading to more susceptibility to a concussion, right? And that's where preventative health, and if someone's in a sport like football or even soccer, and all these things, I mean, today it's not even football always, right? Soccer's just as bad, but cheerleading, dance, all these things are girls flipping in the air, landing on their tailbone.
Cheerleading is a dangerous sport.
It is a very. I always say we had more when we worked at Oaks Christian. We had more cheerleading. Cheerleaders coming in for concussions than probably football players.
We did a lot of injuries too.
Yep.
Yeah, and the thing is, some people say, well, it couldn't be a problem with my brain because I didn't hit my head.
Right.
But if you understand the anatomy, if you just look at the brain and just imagine a big balloon, and then the balloon continues all the way down to your tailbone.
Right.
And if you put pressure on the tailbone and squeeze that balloon, it's going to put pressure up in the brain. They'll bend their neck and they'll have low back pain, or they'll bend their low back and they'll have neck pain. It's all connected.
All connected,
And,
absolutely.
and it needs to be clear
Yeah.
from the brain tissue through the spinal cord,
Right.
all the way down.
Right.
So,
No, and you're exactly right. I mean, we get, people that fall off a horse on their tailbone. I did so much with Red Bull and all their, high intensity sports, and snowboarding was always, these guys always said, I never slam my head into something. Now they flip like this and don't think they hit their head, but their head's whipping around.
That's exactly
but
right.
Slamming the tailbone, like I said, it can hit and go up, but it also jars. When you slam into that ice at that speed, it jars right up in your head. It goes back and jars like this too, and it causes a little whiplash too. Yeah. But yeah, there's so many things that I get. I think the same as you, that people come in like, no known concussions, because they didn't go to the ER and had a brain bleed. However, 98% of even serious concussions don't cause a brain bleed, will be negative on an MRI. You always want to check for those things to make sure there's not something that could cause a major issue. But most of it is just dysregulation of the spine and brain and nervous system.
Exactly right. And and the other thing too, it's cumulative.
Yeah.
So it's like no one just falls once.
Right.
And then it builds and builds and builds and causes more damage. And a lot of times you can have a problem with the brain, or you can have a problem with the spinal cord and not feel a symptom, because a lot of people don't realize only 6% of your nerves are pain fibers.
Right.
The other 94% control your immune system, your digestion, your healing, and the function of your body. So again, we test, we don't guess. We look for any kind of neural pathways that are interrupted or fixations in the spine, because we want it to move.
Right. And that probably leads me to, one thing that I get parents that ask me all the time, should I let my kid play football, right? Should I let my kid play this sport? And here's the thing, any sport you play, you have the opportunity of getting a concussion. I mean, maybe there's some that have less, susceptibility to it, but, I don't know that it's necessary that we eliminate every sport that you can possibly have a concussion, as much as the more aggressive the sport and the more chance of head injury, to do those baseline assessments, to do in the off season, to come check and make sure everything, get an assessment, make sure everything's still aligned, make sure the brain has not altered and changed and that we're not building up. Because if you get a first concussion, that's bad, but it's the second or third cumulative side to it that becomes exponentially worse.
Yeah, and parents spend a lot of money on coaching, travel for sports and those things. But if you want your child to perform well, your body's got to operate well. It controls your balance, your muscle growth, everything about your retention of patterns you're trying to duplicate in your sport. Everything is on a neurological level.
Neurological deficits that happen can change their ability to focus in school, change anxiety, change their whole, like I said, even balance, even walking and coordination, things like that too.
Sleeping patterns?
Sleeping patterns, absolutely. That's one of the big things we see is changing sleeping patterns. And when that goes off, we'll have to do a whole nother one of these on sleep.
Oh, just for the detox of the brain. And
absolutely.
That's vital.
Yeah,
so
we'll hit that, and we'll hit the whole gut microbiome and everything too. That
all the chemicals made, like the dopamine and the serotonin made in the gut coming up, and I think there's over 100 million neurons in your gut. That's why they call it the small brain.
Absolutely.
So that's going to be. We'll have to dive into that
one.
And
the neurotransmitters that run your brain are all
made
in the gut.
And how do they get to the brain? They travel up that vagus nerve, and if there's restriction, if there's a fixation, which we remove, the brain can't hear it.
Exactly.
So we need your gut healthy, and we need a clear communication to your brain, and the nutrition that we're both into.
Absolutely.
For the brain and the body.
And there's a lot of nutritional things that you can do to help make your brain and body more resilient towards concussion as well. I promote the omega-3s from the brain. You need the fluidity of those those dendrites and neurons to be able to bend and to move as you jar your brain, not to have that rigid structure that can break them so quick. And things like magnesium that can control some inflammation afterwards. You don't want that inflammatory cascade what are some of the ones that you usually recommend?
You need calcium for your muscles and your nerves to fire, but you need magnesium for them to relax.
Exactly.
So a lot of people can't sleep because they're thinking all night and they can't do that, and their muscles are tight.
Yeah.
So they can't sleep. So magnesium, we test a lot of people nutritionally, and a lot of them are deficient in magnesium. You need it for Krebs cycle to convert food to energy. You need it for, I think there's over 300 different processes in the body that uses magnesium.
I've heard that 300.
And why wouldn't you take it?
Many years, and I just heard like 600 the other day. So
Yeah.
probably 300 or more.
And the brain and the spinal cord are made of fat, and it's actually made of cholesterol.
Yep.
So if you don't have the right amount of cholesterol, you could have brain damage as well. So we want to have the right nutrition. Again, it's multifactorial. And that's, I think, what we're trying to say here. Your injuries are multifactorial. It was, I think it was Roger Sperry, the Nobel Prize. He was a brain researcher. I think it was in the 80s. He said that 90% of the stimulation and nutrition going to the brain was because of spinal movement.
That's exactly.
So we got to exercise.
But one of the most important things to the brain. And that's where I tell people all the time, one of the most important things you can do to age well is keep moving. Right? We've all seen the person that, as they age, fall down, break a hip, they're in a wheelchair for 3 months, and you watch their cognition just shoots down.
100%.
Because you need that energy that's created, the kinetic energy from movement.
And the more I study it, cardiovascular, we need that. But I think muscle is the bank of longevity, because what happens, a lot of people fall.
Yeah.
And, and I think we got to look at the brain too as a muscle, right?
Yeah, absolutely.
Because if it doesn't get that stimulus, use it or lose it, just like a muscle.
It atrophies.
So we want to stimulate that brain as much as possible, and exercise is a great way to do it.
I love it. So if we had to say, kind of a summing up of my kid's going to play football, what do I need to do? From what I've heard is, at least from my side, which I think you're saying too, is probably in the off season to get a quick brain map and look and make sure the brain's staying in a good state, to get an assessment. You're talking about more a postural, right, mechanical side, maybe nutrition side, to make sure everything's firing right.
Exactly. We actually, like I said, only 6% of the nerves are pain fibers. So we do skin temperature difference, which looks at the nerve flow for the blood vessels and internal organs. We do a resting EMG to look at the nerves to the muscles. And we do heart rate variability to see how your autonomic nervous system adapts to stress and how you deal with that, because we're all going to have stress, but we need to adapt from that parasympathetic rest and digest to the sympathetic fight and flight, and just be right in the middle there.
Absolutely.
And so we can check that and see what's going on.
And it's really looking at a lot of vagus nerve health.
Exactly. That autonomic nervous system.
And then, the right nutrition to kind of keep your brain more resilient. And then if you do get a concussion, to treat it like an emergency, right?
Yeah.
To get in and and to get a brain, see what changed, especially from a baseline, to make sure it didn't make any changes from a mechanical standpoint, because the brain, I'll tell you what, brain and body are one of the best compensation engines there is.
It'll do everything it can to protect you. And it'll adapt. It wants to do the best for you, but if there's a problem that it can't fix, that's where we come in.
That's exactly right. Well, great to see you again.
Thanks for having me.
All right,
it's so great working with you.
You too.